Good afternoon, and I guess good evening for some of us. And thank you so much for joining today's Physician Advisory Board meeting. This is kind of like the end of Q2 meeting for us. I'm Dr. Chandra, cardiologist and electrophysiology fellow at New York Presbyterian. Really excited to lead this discussion on behalf of Prevounce Health. And in this meeting, we're going to be continue to explore ways to improve remote care delivery through smart and clinically relevant tools. So joining us today, I'm thrilled to welcome two incredibly knowledgeable and distinguished colleagues of mine. First, Dr. Gupta, an emergency medicine physician with deep frontline experience in acute care triage, as well as Dr. Tony Wang, an ICU physician and an anesthesia physician with insight into some of the most complex and high acuity patients we manage. So I'm looking forward to learning from both of you and gaining more of your perspectives as we continue to have these quarterly advisory board meetings. And today we're going to, talk about an interesting topic, AI, and how AI can truly enhance, definitely not replace, but how AI can enhance clinical care. I had a set of questions that I wanted to discuss with you both regarding, in general, the use of artificial intelligence that, AI has really, made a place in my clinical practice. I'm sure both of yours clinical practice. So I really want to pick your brain into the utilization of AI in RPM, CCM, and clinical care. So starting off with some questions here, Dr. Gupta, I think we can start with you. In your experience, what are some of the biggest gaps in chronic care follow-up, even sort of clinical follow-up in general that AI might help address?
I mentioned this last time. I think a big problem that pervades through CCM and RPM is data overload, because the benefit of these technologies and these changes in clinical workflows is that you get access and you generate more data. But we haven't yet, I think, fully mastered the art of knowing what to do with that excessive data. That manifests itself in different ways. When you have too much data, you might miss trends, you might not be able to interpret it properly. And when you have too much data, you also run into issues with alert fatigue and overload, cognitive overload, um, which I think AI can really beautifully navigate. And that's probably the biggest gap and most immediate gap I see in the short term with artificial intelligence and CCM and RPM. So managing excessive data, identifying trends in that data, and preventing cognitive overload is probably the best way I see this short term. I will say though, as a caveat, the field of AI, at least front-facing, consumer-facing, patient-facing, is all so new that the potential is huge, and there's probably gaps that we don't even appreciate right now that AI will start to address. But in the short term, I think the biggest thing that I notice is that it can manage the problem of too much data really elegantly. And these, especially the LLMs, I think are really good at just taking a lot of data and summarizing it into digestible formats.
Yeah, that's a really good point that you bring up. And I think it's already started to definitely improve the lives and help our care managers processing this large amount of data. Dr. Wang, any thoughts on this?
Yeah, absolutely. I 100% agree with that. And I won't repeat the same thing. I think another thing that is key is integrating, using AI to help integrate data from different sources. For example, right now, it can be challenging if there's, let's say you have a patient who isn't known to your system, or they see different doctors for different things that use different either EMRs or different healthcare systems. How do you bring all that data together plus any data from wearables, right? That's all, like, for the physician's burden to have to go through all of that separately and see it in separate tabs. That can be a lot, and it's easy for things to be missed, right? You miss things like trends because you're not seeing it all in one place on one screen. So I think the role of AI has a lot of potential in that.
Mhm. And Dr. Wang, Dr. Gupta brought up at least one concern that he had with AI. Any concerns from your clinical practice that you've seen already with artificial intelligence?
Oh, I mean, of course. I think that the the biggest concern anytime you have anything that's automated is that patterns get picked up where they don't exist, right? Or diagnoses get brought up that are not true, right? And so that's kind of the biggest risk, is overcalling something that maybe otherwise wouldn't have been called by humans.
So, I wanted to shift gears a little bit to talking a little bit about the Prevounce AI tool. And I shared it with both of you, and you guys have reviewed it at least a little bit in part prior to this meeting. I wanted to get both of yours initial thoughts on the product, and do you think it's good for our care managers or hardworking care managers here at Prevounce? So this time I'll start with you, Dr. Wang.
Yeah, sure, absolutely. Yeah, so I took a look at some of the screenshots that you had sent. I think it has a lot of potential because when you see the screen of all of the remote data that's collected, it is kind of, I had voiced some of these concerns earlier in our first meeting, which is there's a lot of data to go through, a lot, day by day blood pressure measurements with heart rate measurements, pulse ox measurements, and it can be hard to, let's say if you see this patient once a year, it's realistically, it's very hard to go through 365 days of all that information and be able to see any trends or make any decisions based off it. So I think for a start, it is nice to just have one quick summary that synthesizes that information. And I think that the key is in kind of how accurate that is, right? And so I go back to, are we are we able to kind of verify that data based on a patient that we did do a deep dive analysis on and prove that the analysis that the AI is doing is accurate? But I see a lot of potential in the functionality that you already have.
All right. What about you, Dr. Gupta?
Yeah, I would agree. There's definitely a lot of potential, and it already does a really nice job of taking data overload and putting it into digestible formats. Like Dr. Wang was saying, like when you're reviewing all the blood pressure data, having a summary on the side gives you a nice context for what you're looking at. And then if you want to see more granular data, you can use that as a launching pad to be like, okay, there's a summary. Okay, a few weeks ago, maybe more hypertensive, now less hypertensive. Let's see the transition point, see kind of what happened. I think to take it to the, and 100% would help, the chronic care managers with a lot of administrative, I think, tasks and also dealing with that data. To take it to the next level, I think what I would love to see is number one, like more smart integration of how you use those trends. Like, there was a trend noted. Are there other data points that we can associate with those trends that give possible explanation for that? Either a summary of interventions that were made by the clinician or new symptoms, or, just in the background. This is the trend we're seeing. This is the patient's medication regimen. And maybe there's some third process going on that's unexplained by our interventions or by patient symptoms. So I think the question is like, we have this trend, what do we do with it? And that would help answer that. How do we actually take clinical action based on that data?
The last question I have for you both is, I guess going forward, just like our integration of or our utilization of AI in the Prevounce products, going forward, more and more products in the medical space are going to be utilizing AI. So my question is to you both, to what degree do you guys see AI functionality in your product influencing which technologies you guys are going to use? And if the existence of AI or lack thereof is going to either support utilizing a product or not for both of you. So we'll start with you, Dr. Gupta.
The inclusion of AI, I think, definitely is is insight and indicative of the fact that that program, group, company is willing to embrace new technology and is definitely willing to have a forward-thinking mindset. So that to me is a big plus, because as change occurs, I think it's good to embrace that change. Then part two is how do you embrace it smartly, and what features would make me want to use one tool over the other? Probably one is transparency on how these tools are designed and what training background these tools have, what data sets are they using, or what testing they've undergone. Number two, does the program or tool address very obvious and common pain points? Is it truly making an impact, or is it just introducing more data and more bulk to a process that is already has too much data? And then I would say that the third and fourth part is does it address equity? Like, is it improving, or is it improving equity in a field in which rapid changes in technology already cause bigger divides in patients that have access to technology and patients that don't? And then finally, how human involved is it? I think these early stages I mentioned, these AI tools need to be human involved. And so whether that means having some human oversight or some key integration with a true clinician, I think is going to be really important in these early stages for deciding which AI tool to use.
And Dr. Wang?
100%, it makes sense for any company out there that's doing RPM or CCM to integrate AI into the system. And I think that the first groups that are able to deliver a package with all of that are going to be the front runners for in this space. Because selfishly, right, it saves me time, right, as a physician. This technology allows me the option to not only see the data myself, but also get an AI summary of it, right? So I think it's a no-brainer to integrate that technology, and I think it plays a big role. And I feel like I've said it many times, so I do, at the risk of repeating myself, I'll say one more time that the key is in how accurate it is, right? Because if it's inaccurate, then of course it adds risk to your practice, and then all of a sudden it becomes a burden, right? And we haven't even talked about the other possibilities that this can lead you down, which is such as like anchoring bias, right? Like maybe there's something else more sinister going on that the AI doesn't recognize and labels it as just worsening hypertension. And so now, instead of thinking more broadly like we're trained to as physicians and thinking, oh, is this, it's weird, like we've up titrated the medications 4 times in the last 2 years. Should I do a Phio workup, right? And that's something that I don't want to be missed just because a physician has the ability to use this technology. So physicians still definitely have to think critically about their patients. So that's the only kind of asterisk I'll put on that.
All right, perfect. Well, thank you all for your time again and for sharing your insights. Always great to hear from the both of you, and you always have really great things to say. I think, in summary here, I think AI definitely holds real promise in, definitely streamlining care and supporting clinical decisions. But I think it should be definitely implemented with thought and caution, with the care manager and the clinician at the center. The care manager and clinician at the end of the day are going to be the ones that are going to be making the decisions.